Hi, my name is Sabrina Roscoe, and I'll be doing my postpartum assessment. And this is my patient, Julia Muniz. Alrighty. So how are you feeling today?
I'm feeling good.
Feeling good? Okay. And how do you feel about your baby?
I love him.
You love it? That's good. I'm going to be doing your postpartum assessment. First, I'm going to take your vitals, and then I'm going to go through a head-to-toe assessment, and then I'll be teaching you along the way, okay?
Mm-hmm.
All right, I'm going to clean my stethoscope. I have alcohol pads, and I'm cleaning my stethoscope. All right, okay, I'm going to go ahead and take your blood pressure, respiration, temperature, all that good stuff, okay? I'm taking her blood pressure. Her blood pressure is 120/80. Okay, I'm going to check your respirations, and then I'm also going to check your pulse at the same time. All right. Her pulse is 100, and her respiration is 18. And I'm going to check your temperature. Open your mouth. Her temperature is 98.6. And can you rate your pain for me?
I'm going to be about 6.
A 6. Okay, so I can give you your pain medication as prescribed, but after this assessment, okay?
Mm-hmm.
And where's your pain located? In this area?
Mm-hmm. Yes,
ma'am. And you gave a vaginal birth?
Yes, ma'am.
Alrighty. Okay, so I'm going to listen to your heart. And I'm also going to listen to your lung sounds, okay?
Okay.
First, I'll listen to your lungs. Can you take a deep breath for me? Okay. Another deep breath for me, please. Alright. I'm going to listen to your lower lobes. Okay? Alright. And I'm going to listen to this one. Okay. Now I'm going to listen to your heart. She has a good rate and rhythm. Alrighty, so I'm going to listen to your lung sounds in the back, the lower basses. Okay. Again. Okay. Her lung sounds are clear. There's no diminished sounds on the lung base, and there's no crackles as well. Alright, now I'm going to check for your kidneys, and I'm going to hit your back, and if you feel any pain, let me know, okay?
Mm-hmm.
Actually, can you turn that way so I can show the camera?
Mm-hmm.
Okay. You feel any pain?
No.
You feel any pain?
No.
Alrighty. Okay, so now I'm going to look at your breasts, and I'm going to listen to your bowel sounds, okay?
Mm-hmm.
So I'm looking at her breasts. I uncover mom. Her breasts are not swollen or engorged. They're soft. Her nipples are not cracked or bleeding. And she is, are you breastfeeding your child?
Yes, ma'am.
Alright, okay. And have you been able to see any colostrum?
Yes.
Okay, that's good. That's a good sign. In the next few days, your milk will turn yellow. That's a good indication. And then slowly will turn white.
Okay.
And has he been breastfeeding good, latching on good?
Yes.
Okay, that's good. Alright. And now I'm going to listen to your bowel sounds. You can lay back for me as much as you can. Okie dokie. Okay, now I'm going to palpate your uterus while also holding her pubis symphysis. Palpate. Her uterus isn't boggy, it's not deviated to the right, it's palpable. As I palpate, there are no clots. I'm also holding her pubic symphysis just in case the uterus slips out. Everything seems intact. Alright. Okay, sorry, I'm going to uncover you again. And I'm going to check for your lochia. And it looks like normal period blood. There's no odor. It smells like normal period blood. I'm checking to see if there's any clots, and there's no clots. And I'm going to check her lacerations from her vaginal birth. There are a few minor lacerations, but that's normal. There's a little bit of swelling, but that's normal as well. Okay, and I'm going to have you turn to your side, just in case there's more blood. Alright. There's no blood on the patient's back, and there's no blood down the bed as well. There's a good amount of lochia. Alright, you can turn back around for me. Okay. Now I'm going to go down the patient and check for Holman sign. Okay. I'm going to check for any tenderness. Feel any warmth. Okay. Yeah. Alright, I'm checking for Holman sign. Even though they say not to, there's a very low risk of a DVT dislodging it, I mean. Alrighty. And I'm going to check for any pitting, edema. There is no pitting. No pitting present. Okay. And now I am going to check your deep tendon reflexes. Dead weight for me, please. Okay. Okay. Alrighty, I'm gonna do it to the other leg. Okay. Alright. And then, can you put your foot up? And then bring it down. Can you put your foot up? And bring it down. Alright, there's no clonus. That's good. Alrighty, and I'm gonna talk to you about just life. So, how are you feeling with baby?
I'm feeling really good. I like him. I love him.
You love him? Okay. And do you have any support with your family?
Yes. My mother and my husband are helping me take care of her.
That's good. Okay. Just know that it's normal to cry after birth. Your hormones are fluctuating, so if you just feel like you're crying for no reason, that's normal. And just letting you know, I know you feel happy now, but in the future, let's say a lot further along the road, it's 3-4 months, and you feel like you can't do it, can't take it anymore, and you have no interest in taking care of your child, that might indicate postpartum depression, and I really recommend to talk to your healthcare provider.
Okay.
Alright, and now I'm going to check your skin. I forgot to check your skin. So I'm going to check your face first. There's no sign of the mask of pregnancy. I'm going to check your linea nigra. There's no linea nigra. Well, there is a linea nigra, but it's diminishing, which is a normal sign after birth. And I'm going to check for any stretch marks. The patient has some striae on bilateral sides of her abdomen and bilateral sides on her thighs, which is normal, and that's okay because we are adjusting to our new body. Alright, are you experiencing any sweat at night?
Yes.
That's normal. Okay. I know it might be a lot, so you might smell funny, but it's normal. You're mostly sweating because we gave you a lot of fluids during labor. You might be sweating because of also hormone fluctuation, and also when you're pregnant you had more blood volume than you did before. Mm-hmm. So you're just trying to get all of that fluid out for the next couple of weeks. Okay. And so for your diet, you're going to have to drink 300 to 500 more milliliters than usual to keep up with your breast milk. Because that's going to take a lot from you, and baby works on supply and demand, and that's good. Mm-hmm. Drink a lot of water and also eat plenty of food. I know it's hard when you're taking care of baby and lack of sleep, but you need to eat if you want to keep breastfeeding. So for activity, if you can walk, I recommend walking just so you don't get a blood clot in your leg. You want to prevent those. So if you can walk around the house for a good 10 minutes every 2 to 4 hours, that's good. Don't pick anything up that's more heavier than baby.
Okay.
So no laundry, no vacuuming. Try to get as much help as possible. If you can't, then I will try to help you as much as possible as well.
Okay.
Okie dokie. And that was my postpartum assessment. Oh, I hope it was recording. Yes, it was.